Hey, Stacy, good to see you. You don't have to answer, just want to say hello.
Hey, I want to say hi to you. I wanted to log on now just so I wasn't late. So,
Oh, I hear you. Good to see you. Welcome, Debbie. We still have a few minutes yet, so hang out. Welcome, Sherry. Debbie, since you're the only one I can see, could you tell when I shared my screen just a moment ago? Could you see that? You're on mute, Debbie.
I had stepped away. You want to do it again?
Yeah, thanks.
We saw it when you did it.
Oh,
Yes, I
perfect.
can see it.
Thank
Yep.
you. Thanks, guys. Appreciate that.
You're welcome.
Hi, Claudia. You are on mute, my friend.
How are you? Can you hear me now?
I can hear you now. Yes, I am well. How are you?
Good, good. I sent John the link because he didn't have the link either.
You know, it's the most obvious details that I have managed to overlook for this. Everybody else has the links, but the two people that needed them the most.
Hi, Sherry.
How are you?
Good, how are you?
Much better after the Greencastle water people left my front porch this morning.
Oh, no.
You have used 4,000 more gallons of water than usual. I'm like, oh. Yeah, much better now.
And what was the problem?
I got a new water heater a couple weeks ago because it was leaking. But they didn't inform me until today. They're like, whoa, look at all this. We could have floated away before they would have known, but I don't know. They're friendly folks.
And there's Bill. Hi, Bill. I don't know if he can hear me.
Looked like he was, is that the gentleman with 17172?
Yeah. Hi, Bill. There he is.
Okay, yep, I was just getting ready to ask for a name there because I'm taking attendance. But I got it. Thank you.
So Tim, add Nikki Wilkerson. See, you can kind of see her head back here. We're in the
Hi, my
same.
new
Hi, Nikki.
friend.
Hello.
I just met Nikki last night.
Yes. She's in the green room now.
And John's connecting. I can see him connecting there.
Yep, I can as well. Looks like we have about 4 minutes. And I have a feeling a lot of folks will be hopping on just after 12.
Hi, John.
Hi, John, how are you?
I am well. Can you hear me?
Yes.
Yes.
Okay, great.
And I get to say something to you that I don't get to say very often in my area, which is go Gators.
Ah, go Gators. Yes.
I normally keep that to myself in the middle of Penn State country.
Understandably.
So we have a few minutes yet before we get started. I'm going to share my screen. Well, actually, I'll wait a little while.
Well, John, it's so exciting to have you here.
Oh, it's great to be here. I'm excited, and yeah, I think this is a subject I can talk about endlessly. So I'm excited. Yeah, definitely. And it's only become more timely, unfortunately.
Yeah.
Yeah,
Ugh.
Claudia and I have had many conversations about your book.
Thank you.
And Bill as well. Bill is a volunteer in the library, and he's a gun owner. So I would be like, Bill, what do you think of this?
Yeah. I've said often that that's, for me, really the target audience are gun owners, people
Yeah.
who, because to make a difference on most of these things, you have to reach people who own guns and hope that they talk to their friends about, locking their guns up and the risk of suicide and all these other elements. So I think that's an often overlooked population in these discussions. So I'm happy that we're going to get to engage people on it.
Yeah.
We have a couple more minutes yet. More people are hopping on.
All of us in our crazy masked worlds.
I know.
Now I'm going to share my screen. I'll make an announcement about this here shortly. I have right at the top of the hour, so I am going to go ahead and get things rolling here. So we have as much time with John as humanly possible. My name is Kim Kreider. I'm a community health coordinator and health educator in Franklin County with WellSpan. And welcome to the book discussion, Children Under Fire. I just need to go over some housekeeping things before we get started, one of which is right here on your screen. For any of the WellSpan physicians or clinicians who are applying for CME credit, I will have this slide up for just the next couple of minutes while I'm speaking, and then again at the end. If you should miss it, you can always reach out to me and I'll connect you to the proper person to help you get that credit, or if you need to create an account. Hopefully you got the prompt that the meeting was being recorded. If not, it is. So thank you for that. We'll have everybody remain muted until we open up for questions. You are welcome to add questions in the chat, just pardon me, as a reminder to yourself to ask those at the end. If you don't, I'll be monitoring the chat and make sure we bring them up. I also wanted to let everyone know that we understand that some of the topics being discussed over the next hour may be difficult for some of the participants on the call. And we wanted to make sure that anyone who needed support had it. And with that in mind, we have two therapists from WellSpan Philhaven, Hillary Flick and Lindsay Kelly, if you could give a wave. We are thankful for their ability to participate in the book discussion today. Should you feel like you need support, you are able to private message them via the Zoom chat and ask for support or resources. I will be adding their names in the chat with those directions, but wanted to introduce both of those therapists before we got into the meat of the discussion. And then lastly, we'll be sending out an evaluation survey link after the discussion, and it should take 5 or so minutes to complete. And those survey results help us adjust programming, create programming, and be able to continue programming throughout our year. So with that, I will turn the floor over to our facilitator today, health science librarian Claudia Pete.
Okay. Hi, everyone. It is my pleasure, my extreme pleasure, to introduce John Woodrow Cox. He's an enterprise reporter for the Washington Post, which means basically that he investigates the forces that cause reported events. For those of you in healthcare, it's he's the root cause analysis reporter. He's the author of the book we're discussing today and has incorporated articles from his Washington Post series on gun violence. And the book was a finalist for the Pulitzer Prize in feature writing. I think it should have won the Pulitzer Prize, but that's another discussion. John has won many awards, including the Scripps Howard's Ernie Pyle Award for Human Interest Storytelling, the DART Award for Excellence in Coverage of Trauma, the Columbia Journalism School's Meyer Mike Berger Award for Human Interest Reporting, the National Association of Black Journalists Single Story Feature Award, and the Education Writers Association's Heckinger Grand Prize for Distinguished Education Reporting. He's also been a finalist for numerous other awards. He attended the University of Florida, where he taught narrative writing, and currently serves on their Journalism and Communications Advisory Council. And all I can say is, wow. We are so fortunate to have you, John, with us today. And I thought it would be nice if you start with an excerpt or a reading of a part of your book.
Sure. Thank you for that introduction. It's really an honor to be here. And I'll apologize in advance if I need a sip of water midway through the reading. I tend to lose my voice when I don't pause for a while. So, but thank you, and I'll go ahead and begin. This is an excerpt. This is the beginning of the book, just the first small section. The boy had come to the end of another bad week, and now the girl he adored wanted to know how he was doing. He hated when people thought of him as a troublemaker, one of those kids who frustrated his teachers and disappointed his mother. But more and more often, he feared that's how they all felt. He had struggled to keep buried what was inside him, a swirling, combustible blend of emotion that the tiniest spark could ignite. It had started as disbelief, even denial, before turning into grief, and then at last, this simmering rage that had clung to him for months. It erupted again a few days prior, so the true answer to the girl's question would have been that he wasn't doing well, but the boy didn't want her to know the truth. Good, Tyshawn McFadder, age 9, told her instead as he stared through the screen of his mother's cell phone at Ava Olson, age 8. It was, for late spring, an unusually brisk afternoon in his neighborhood, just 15 minutes from the U.S. Capitol building in Washington, D.C. Dressed in black sweatpants and a gray hoodie pulled low over his head, Tyshawn stood barefoot as he slumped over the side of an armchair in his mother's modest living room, the cell phone in one hand and a chocolate chip granola bar in the other. Ava, who was 520 miles away in South Carolina that afternoon, told him her week had been hard. Why, he asked. I've just been mad and sad and stuff, said Ava, her hair honey blonde, brown eyes serious, and accent tinged with the South. She wore a blue t-shirt and pink SpongeBob SquarePants bottoms as she sat atop her bed beside a half dozen stuffed animals and a fat brown cat named Charlie. Why? Tyshawn repeated between bites of the granola bar. Ava didn't know what to say. She also didn't want her friend to know the truth, both because it pained her to discuss it and because she dreaded what he might think of her if he knew. For 7 seconds, she didn't answer. I don't know, she said, then stopped and changed the subject. Ava had first heard about Tyshawn nearly a year earlier when she walked into her living room and noticed her mother, Mary, crying on the couch. Why are you upset? Asked Ava, who suspected that, yet again, she was why. No, Mary assured the girl, it wasn't her fault. Her mother explained that she had just read a story I'd written for the Washington Post about a child named Tyshawn who was a lot like Ava. The boy also felt angry and confused and unhappy sometimes because he too had lost someone he loved. His dad is where Jacob is, Mary said, and Ava understood. Mary hadn't let her read my story, but she showed her daughter pictures of Tyshawn, posing next to his dad and flashing the deuces sign in a family photo, playing with a toy alone on his father's couch, staring out a window, his dark eyes empty. The boy looked like he needed a friend, Ava announced, so she got a pencil and a sheet of paper and sat down at her kitchen table. Dear Tyshawn, she began to write in neat black letters. Before their lives came apart, the two kids had little in common other than their ages. Ava, who was white, was a Daisy Scout and wanted nothing more than to become a cheerleader. Day after day, she practiced cartwheels in the dirt and grass behind her home, which overlooked a neighbor's bucolic horse farm. She had lived almost all her life in Townville, a quiet 4,000-person swath of countryside in the northwest corner of South Carolina known as the Upstate. Her dad had always worked in security or law enforcement, and he had always carried a gun, which she never thought much about, if at all. In a community with a single stoplight, at least 6 churches, and an abundance of backyard shooting ranges, most people believed in God and, just slightly less, in their right to bear arms. Townville sat on the eastern edge of a county in which 7 in 10 voters supported Donald Trump in 2016. Gable-roofed chicken houses stood among cow pastures and rolling fields of hay, wheat, corn, and soybeans, and everyone shopped at Dollar General, nicknamed the Townville Target. It was a world that, in Ava's mind, had always been safe and always would be. That changed one afternoon in late September 2016, when she walked outside her school for recess, just as a teenager drove up to the playground in a Dodge Ram, jumped out of the pickup and pointed a gun. One of the bullets he fired struck 6-year-old Jacob Paul, a classmate whom Ava loved dearly. 3 days later, Jacob died. She was so overwhelmed by the loss and the terror of what she'd witnessed that a pediatrician later diagnosed her with post-traumatic stress disorder and recommended that the girl be homeschooled. Ava, who was prescribed both antipsychotics and antidepressants, began hitting herself and yanking out her eyelashes. In the months that followed, she detailed her torment in journals. I can't stop feeling mad. No one ever listens to me. I hate guns. By then, Tyshawn, who was Black, had known since as far back as his memory stretched about the bad things people could do with guns. On his dad's dresser in Southeast Washington was a reminder, a 3-inch button inscribed with "Rest in Peace" that honored a family friend shot 2 blocks away. Tyshawn was growing up in a time of rapid gentrification across the 700,000 person city, but the change had yet to reach his side of the Anacostia River, where more than half the district's homicides occurred. Nearly every other child grew up in poverty. It was amid this chaos that the boy lived part-time with his father, Andrew McFadder, in a row of 70-year-old duplexes around the corner from a liquor store. The vast majority of his overwhelmingly Black section of the city rejected Trump in 2016, as did the rest of Washington, which cast just 1 in 25 votes for him. Parents in Tyshawn's neighborhood viewed firearms less like sacred objects than like carriers of an infectious disease. But they were everywhere, despite the district's strict gun laws, thanks to the demand from drug dealers and gang members, and a supply from surrounding states with much looser laws. The impact was perpetually devastating on the community, where many boys and girls learned to navigate peril before they learned to read. For kids in Tyshawn's neighborhood, the unrelenting threat of gun violence informed almost every aspect of their lives. The streets they walked down, the parks they visited, the pictures they drew, the nightmares they had, the number of parents they came home to. Tyshawn's mom, Donna Johnson, had fretted since he was born about how that environment would affect her son. So she decided that the best way to keep him safe was to keep him busy. He made s'mores at Cub Scout gatherings and took lessons for hockey, swimming, and software coding. He liked football and decided at a wiry 4'4" that he would play linebacker in the NFL for his hometown team when he grew up. Donna, a 30-year-old State Department security officer, was desperate to protect his goofy innocence, the quality that led him once to secretly record himself rapping an original song she discovered later. "What are those on your toes? They can't be Doritos," he rhymed, then nodded to the camera, feeling good about his track. "That's the new one," he said. She struggled to preserve that piece of her boy, who had both a deep well of compassion for people he sensed were suffering and a tendency to explode in anger, often with his fists, when he was being teased or challenged. "I just wanted to be different," Donna would say, because she had already seen too many tough young boys who, when they turned into tough young men, ended up in prisons or caskets. By age 7, Tyshawn had narrowly escaped harm from gunfire twice, and 3 of his father's friends had already been killed. Then came that week in early 2017 when, over 7 days, 6 people were shot on a single street that ran through their neighborhood. The last of them, and the only one who didn't survive, was Tyshawn's father. The loss unmoored Tyshawn, whose dad was also his best friend. They were twins, said people who knew Andrew as a boy, before the dreadlocks. Same chocolate eyes, strong chin, quiet smile. Andrew was the fun parent, the one who stayed up with Tyshawn well past his bedtime, playing the violent video games Donna didn't like. But Andrew was also the parent who, while Donna worked, attended parent-teacher meetings and seldom missed a school performance or ball game. As the weeks passed and the signs of the boy's sorrow waned, his fear and fury bloomed. At home, he began to talk less of the things he missed about his dad and more about the man who'd killed him, and whether he would come after Tyshawn too. At school, he shoved a boy who he suspected had laughed about the shooting, later threatening to punch another he thought had done the same. One day, after a long stretch of quiet during a drive home, he told his mom he wanted to die so he could be with his dad again. Tyshawn McFadder didn't get shot, and neither did Ava Olson. Their small bodies bear none of the grisly physical wounds that our nation assumes to be the direst consequence of gun violence. But the damage that bullets did to both of them was immense. Their experiences as young Americans were not in any way unique, though. Every moment of every day, gunfire reshapes our kids' lives because of whom it takes away, or what it makes them witness, or how it forever changes their view of the world. And time after time, the people who love them wonder the same thing that people who love Tyshawn and Ava wondered about them. Would these children ever recover?
Wow. Thank you for that.
Sure.
I mean, based on just that intro, let me begin by saying that I feel this book should be required reading for all gun owners. Your weaving of the stories of all the children, Jacob, Ava, Tyshawn, Tyler, their families, and others, really did a tremendous job of demonstrating the ripple effects of gun violence. In fact, when I was talking to Bill, and I'm going to mention Bill a lot, who's volunteering in my office, I think that was one of the things we mentioned all the time, is that we think, just like you said in that intro, that it is just the child or the person who gets shot that's the victim of gun violence, but the ripple effects are just tremendous. And frankly, I had to read the book in spurts because there were parts which were extremely difficult for me, especially the description of the shooting of Jacob in Townville, South Carolina. You did such an incredible job of describing Jacob, which made me feel as though I had known the little boy and that he was just, so dear. And so I guess my first question to you is, what was, and what is probably, because I know you're still investigating it, but what was the most difficult part for you as a journalist in covering gun violence and writing this book?
I think both the hardest part and the most enriching part was all the time spent with these kids, because their potential is so obvious and their trauma is so obvious, and seeing the gap between sort of where they are and where they could be, and knowing the hard truth that because of what they've gone through, they might not ever get there. And I've spent now 4 years. I'm into the 4th year of covering this this subject, and time and again, you just see the immense damage that has been done to these children, and it's so dispiriting because it was all avoidable. This is one of those things that they didn't have to happen. None of these things that I've written about, none of these kids who've been affected by this trauma, it wasn't necessary. It wasn't inevitable. These were all decisions that adults made that led to these kids being in this situation. And I think too, the other challenge has been conveying the scope of this problem to people, which is sort of the aim of the book. And that's why I focus on kids who weren't shot, because societally, we focus so narrowly on the kids who are wounded. There was a school shooting yesterday in Virginia, and 2 kids were shot, and neither of them were killed, which is why it's not on any front pages anywhere in America, including the Post. But the truth is that those 2 kids represent a very small number of children who were in that school yesterday and thought they might die in their classroom. Hundreds of them were huddled in darkened classrooms thinking, I might get shot to death in my classroom. And the idea that those kids are going to be okay this morning or tomorrow or the next day, or some of them years from now, they're still going to be living with that. And that's what Ava and Tyshawn and all those other kids I wrote about illustrated so clearly for me, is that we're not thinking about this the right way at all, is that the scope of this problem, it's not hundreds or thousands of kids, it's literally millions of children who are suffering trauma, either because they live in a neighborhood where gun violence is prevalent, or they go to a school that's practicing lockdowns and lockdown drills. And in the back of their minds, they're thinking, well, when is it going to be my turn? When is the school shooter going to show up to my school? That's a very real impact on literally millions of children.
Wow. Well, we're also having this book discussion this month because we're recognizing Suicide Prevention Month. You mentioned in your book that gun availability increases the risk for suicide threefold. And our epidemiologist, Sherry, who's with us for the Mental Health Association of Franklin and Fulton Counties, said that often in death by suicide cases, the person will use the method they are most comfortable with.
Yes.
And you talk about suicide in the book. Can you, expound on that a little bit for us?
Yeah, absolutely. I mean, I when people ask me sort of, what's the one thing that I hope readers take from this, it's that, gun owners lock up their firearms. That's really, like, if there's one impact that this book could have, it's that. And it really begins with all the data we have on suicide, both among adults and among children and teens, one of the most compelling things that I found in researching the book, I talked to a group who had done a study trying to determine how best to predict youth suicide rates in different states. And they found that the best way to predict suicide rates was the percentage of homes in the state where a firearm existed. It was not the percentage of kids who'd previously attempted suicide. So the better predictor was simply the presence of guns in homes. And it does get to the idea that Sherry raised, right? Is that people are more likely to attempt suicide with the thing that they're most familiar with. And we know this in part because of research done in the military, that generally speaking, in the general population, women survive suicide at a much higher rate because they don't use firearms, because generally speaking, they're less familiar with firearms. That is not true in the military, because suddenly women are trained much more often with firearms, they're more familiar with firearms, so they tend to use firearms at the same rate that men do in the military, which means suddenly their survival rate plummeted. If a child doesn't have access to a firearm, the likelihood that they're going to survive the attempt with pills or a knife or something like that is so much greater than if they attempt with a gun. The survival rate is less than 10% when someone uses a gun to try to take their own life. And it's time and again, people just assume that they can educate their child or their teenager out of making a bad choice with a gun. They assume that enough training and enough education will ensure that that kid won't make that decision. And it is absolutely false. You cannot educate a child out of curiosity, and you cannot educate a teenager out of being impulsive. This isn't my opinion. There's study after study after study shows that to be true. There was this great research done in Texas among teenagers and young adults, and it asked them how long between when you first had the thought of suicide did it take for you to actually attempt? And I think it was about a huge percentage. It was 5 minutes between when they had the first thought of suicide and when they actually attempted. And if there's a gun in their parents' dresser drawer, they're almost certainly going to be dead in 5 minutes, right? And what we know is that the overwhelming majority of people who attempt suicide do not ultimately die by suicide. So, there's just so many reasons not to allow access to kids to a firearm. I mean, it's just, we could overnight cut beyond the suicide piece, we could cut school shootings in half overnight, if kids simply did not have access to guns. If we did that one thing, we just said, okay, all gun owners, lock up your firearms. Overnight, the school shootings would be cut in half, and thousands and thousands of children would be saved from either taking their own life intentionally or accidentally shooting themselves, accidentally shooting a parent, a neighbor, a friend, a relative, or a cousin. I have a story coming out next week about a 7-year-old boy who accidentally shot his relative, a 4-year-old girl. He shot her found a gun that was loaded and unlocked, shot her through the neck, and she's paralyzed now for the rest of her life. Just because of that, forever changed his life, her life, the kids who witnessed it. The ripple is enormous from these things. So, I can't sort of emphasize enough. And the way I also look at it is this would do nothing to deprive law-abiding gun owners from buying all the guns they want, from owning all the guns they want. It is simply saying, just be responsible with the deadly weapons you have. Keep them from falling into the hands of children. This doesn't affect anyone's constitutional rights to own guns. It just says, be responsible with the gun you have, because it will save thousands of kids' lives over the coming decade. And of course, that's what one of the chapters, the little boy in South Carolina, is what that entire chapter is devoted to.
Right, and that chapter was really profound because that little boy, I mean, there was nothing that indicated he was going to do that. So in addition to locking up, it's important that the parents do not tell the children where the keys are or what the code is, no matter how responsible the child seems, because we all have bad days.
Right.
And even though I was a teenager like a long time ago, I remember having those days where I'm going to kill myself,
Right.
but my family didn't have guns, but yeah, so it's really locking them up and not giving any children access,
Right. Yeah.
no matter what.
Tyler's
Yeah,
a great example, right? I mean, that gun was locked, but he knew where the key was, because his dad, this 11-year-old boy who, his dad had educated him on guns. He'd never shown signs of depression, never talked about suicide, had lots of friends, no trouble at school, 0 red flags, but he just knew where the key to the safe was, and takes the gun out and kills himself.
Right. And his parents forever are changed.
Right.
The officers in the case are changed because it's a small community and everyone's, that was, another, and I read that first in the Post and then read it again in the book.
Right.
And just to let everyone know, Pennsylvania gun ownership is listed as 40.7%. And is the single best predictor of a state's suicide rate as the percentage of guns in the household. So, pre-pandemic, and Sherry shared this, and Sherry can talk as well. Pre-pandemic, the average age of suicide was 57. Today, it is in the low 30s. All 5 recorded deaths of suicide for people under the age of 32 this year in Franklin County was gunshot wound to the head.
Yeah.
Dr. Liana Wen just wrote a book called Lifelines, A Doctor's Journey to the Fight for Public Health. And she also wrote several facts in her book that a majority of the gun deaths are due to suicide. And she also says that physicians play a role in gun safety, which brings me to the next question. One of the big takeaways for me was the need, of course, to safely lock away the guns so the children don't have access, which we just discussed. And since reading the book, I've spoken to so many people who have guns in their homes, often loaded and ready to go in their nightstands, desk drawers, etc. In fact, in July 2020, there was a 13-year-old boy in our area who killed his 9-year-old brother because he wouldn't play cops and robbers. The boy's father kept 2 loaded 9mm Smith & Wesson handguns in an unlocked console of the living room couch. Both parents are being charged with 2 felony counts of child endangerment. Apparently, the other siblings said their brother often would handle the handguns and pointed at them. Was it shocking to you that, in the research for your book, that so many adults really don't think having guns out in the open is bad? That just shocks me.
Yeah, it is shocking, and in part because these stories are written literally every day. Somewhere today, probably during this discussion, a child will find a gun and shoot himself or a sibling or a parent or a neighbor or a relative. It happens. So it's not something that people are unaware of, but they are, what I have found from responsible gun owners, people who are responsible in every aspect of their lives, are convinced that their child is different. They are convinced that it just requires education, even for little kids as young as 4 and 5 and 6 and part of it is because that adult didn't die when they were a kid, right? Maybe they grew up in a home with guns, they hunted as a child, they didn't kill themselves, right? But it's this idea that, well, I can drive 110 miles an hour on the interstate every day and survive. I might live through that, right? But the chances of me dying go up precipitously if I decide to drive 110 miles on the interstate every day. That's the idea, right? It's like, well, sure, yes. In all likelihood, if you have a gun in your home that's unlocked, your kid won't die, most likely. But it makes it many, many, many times more likely that they will. And it's totally unnecessary, and there is no good faith argument to say that a gun should not be locked up, because you can buy a pistol safe and have it right next to your bedroom, right next to your bed. If you insist, if you think that somebody's going to break into your home and you need that gun to protect yourself, which, frankly, the vast majority of home shootings, it's not self-defense, it's domestic. I mean, it is very rare, in fact, that someone shoots a home invader. But if someone reasonably fears that that's a possibility, you can have a pistol safe that costs less than the gun did. And you can have it right next to your bed. And you can either have a biometric safe that recognizes your thumbprint, or a 4-digit code, something that you can have access to in just a couple of seconds to fend off the bad guy who's broken into your home. So, no one has to have a gun under their pillow or in their dresser drawer, because you can buy one of these safes for $200, $250. So they're just, there is no good faith argument for someone to have a couple of 9mm handguns stored in their couch, because this is the end result. And the truth is that the vast majority of the time, the parent is not charged with anything. Not a felony, not a misdemeanor, nothing. And it's often theorized among the prosecutors that, well, they've suffered enough, right? They've suffered enough. Their kid's gone. That's punishment enough for that person. But the truth is that this has to change somehow.
Right.
And part of the problem right now is the laws on the books are not nearly strong enough to incentivize parents to actually lock up their handguns.
Right. Well, and what's great about your book is it's very neutral, and it's in no way telling people they can't own guns. In fact, I think you really focus on responsible gun ownership throughout these stories, as you said. And it seems to me that the NRA is so focused on the Second Amendment right to bear arms that they are missing the big picture. So can you talk a little bit about this? And do you see any possibility of their working with legislators to put federal laws in place to address registering guns and requiring education?
I think the NRA bending on anything is extremely unlikely. I think that they view sort of the argument that they make is everything is a slippery slope, and if we bend on anything, even if it's obvious and rational and would save lives, then that could lead to, more onerous gun laws. The truth is, though, that Americans are not nearly as divided on guns as Capitol Hill is, as the NRA is. Most Americans support kind of these common sense gun reforms. The vast majority, even the vast majority of gun owners, and anecdotally, I know, having spent a lot of time in the South talking to gun owners, when you ask them things like, should there be universal background checks? I've never had someone say, no. Literally, I've never had a gun owner tell me there shouldn't be universal background checks, because the gun owners I'm talking to are people who would pass that background check. They don't have things in their past, domestic violence charges or felonies that would prevent them from getting access to that firearm. That would make a very real difference, universal background checks, things like locking up, guns and preventing them from falling into the hands of children or prosecuting parents. These are things that most Americans, including most gun owners, actually support. Where there is that divide is in Capitol Hill. And it really has more to do with money. It has to do with gun manufacturers and what they want. It's not sort of your typical American who says, I don't want any gun reform, or even your typical gun owner who says, I don't want any reform. It is gun manufacturers who are resistant to laws that could affect their bottom line. I mean, that's partly why we've not seen any kind of development, any progress on smart guns, which would solve so many problems. Hundreds of thousands of guns are stolen in this country every year. Smart guns would pretty much make that pointless, because you could take a gun and you couldn't do anything with it. But gun manufacturers aren't investing in that technology at all. So, there's so much more that could be done, but I don't think you're going to see, the NRA volunteering ideas, certainly around gun registration or anything like that. I think their tactic will continue to be say no to everything.
Right. Well, it's interesting. You talked about it in the book, but this is my lane. It's interesting. Melissa Parsons, who was a physician and gun owner, calls herself a conservative. Didn't go up against the NRA until they made a public comment in an American college of Physicians position paper recommending a public health approach to firearm-related violence and the prevention of firearm injuries and deaths. The NRA wrote, and this is quoted, "Someone should tell self-important anti-gun doctors to stay in their lane." Half of the articles in Annals of Internal Medicine are pushing for gun control. More upsetting, however, the medical community seems to have consulted no one but themselves. The American Foundation for Firearm Injury Reduction in Medicine, AFIRM, has asked the NRA to join forces to find solutions in a nonpartisan, physician-driven effort. And she writes, "We are not anti-gun, we are anti-bullet hole," which I really like.
It's a great line.
And I think she's saying that the physicians have a right to ask about firearms in the home. I mean, in one of the pieces in the book, actually a physician saying to the parents, "Do you have guns at home? Lock them up," saved a young man from dying by suicide.
Right. And that was such a powerful example. I mean, she works in South Carolina in an area that is very conservative and where sometimes that question, do you have guns in the home, offended the parents. But that day in particular, these parents had brought in a teenager who was feeling depressed, and she asked him if he was going to take his own life, and he said flatly no, he was not considering that. And then she asked the parents, do you have guns in the home? And they said yes, and said, you need to get them out, just get the guns out of the house. And then this teenager called back later and said, I was going to go home and kill myself that night with those guns. I mean, he was going to do it that night. So she, in real time, saved his life. And this idea that we shouldn't think about this as a public health crisis is just utterly absurd, because that is what it is. It's not unlike every other public health crisis. And the idea that we basically have not researched this in earnest since the 1990s. Only in the last couple of years has Congress devoted any real funding to gun research again. And if you compare it to other diseases, the rates of death, compared to the dollars spent, it's just like infinitesimal. I mean, it's just nothing that we've been spending on. And it would be, we stopped in the 1990s, which would sort of be like in like last summer, if Congress had decided, we don't like the politics around the research into COVID, so we're going to stop researching it. Let's also quit the vaccines. Let's not look into masks. We're just going to stop. And that's what we did for over 2 decades when it comes to guns. So it's not, the research would have told us safe ways that people could own guns, buy guns, store guns, and prevent people from dying from those bullet holes, right? But we just don't know that. So we're decades back from where we could have been had we devoted the hundreds of millions of dollars into researching this that we could have. But I will say, on a happier note, we are finally, Congress has finally devoted some money to this, which is not insignificant, especially because they did that when, a Republican was still in the White House. So, that's significant. But that's really, to me, the path out of this crisis is to research it. That's been the path out of every other public health crisis, is to understand, well, what's causing it and what can we do to stop it? And right now we know some things, but we don't know nearly enough.
Okay, and then I have one more question, then we'll open it up to everyone else. Several people that I've talked with about the book were appalled by the myriad of companies trying to make money off the gun crisis, especially in schools. You did a wonderful job describing some of them and their belief that they are doing it not for the money, yet for the common good of man. And when you were at this gun safety fair, one of the questions that I had is, were schools actually purchasing a lot of this equipment? And I know that a lot has changed, even in our own school districts. We have lockdown. I know my local school district has had lockdowns. We have security, like a police car that's
Mhm.
actually Greencastle Antrim School District security. You know, were people purchasing this? Is this really a big business now? And
Oh, yeah. Yeah, I mean, schools are spending billions on these products, and it's out of desperation, you know, is there's a school shooting, something like Parkland happens, and then every school in the country panics because they're so, okay, how do we stop this from happening at our school? And the parents, understandably, are leading that, right? They're feeling totally panicked. They're going to keep sending their kid to that school. So there's a desperation that then, you know, leaks down to the superintendent and then down to the principals. You know, it's totally unfair that we have put the burden of solving school shootings on schools, because they can't. It's impossible, right? But that's who we've asked. You know, in the same way that we've asked healthcare workers to solve COVID and to fix it, right? It's like, you know, it's somewhat analogous that if let's say someone is unvaccinated and they get COVID and then they come to you, what are you supposed to do societally, right? What are you supposed to do? It's the same thing with the school. If that child, if a teenager gets a firearm, gets an AR-15 and shows up to the school, what is the school supposed to do then? You know, their best chance of stopping a school shooting is actually someone reporting it before it happens. There is almost no technology in existence that can prevent a determined and intelligent school shooter from pulling something like that off. There are, you know, anecdotal examples. There are things that schools can do. There are, you know, responsible ways of preparing for lockdowns and things like that, doing the drills. There are technologies that help, but things like bulletproof backpacks and doors that, you know, can stop, you know, automatic weapons, these sorts of things. There's just no evidence that any of that helps at all. But, you know, instead of addressing it sort of societally, instead of saying, hey, where are people getting these guns? What's causing these shootings to begin with? It's, you know, let's fortify the schools, when, again, there is no evidence that almost any of those things make a difference. But schools are going to keep buying that stuff because they feel like they don't have a choice.
Mhm. Yeah. Okay, and so I'm going to go ahead and let us open it up. Kim, do you have any questions that have come in the chat? Does anyone have anything that they would like to ask John?
And you're
would.
welcome to unmute. Yeah, go right ahead.
Oh, you okay?
Yep.
I
Oh,
have
I-
it.
Mr. Cox, I'm just, maybe my question's several parts, but there's been a push for many states to have open carry laws. And one is, I think it seems to me counterproductive when we're talking about trying to de-escalate guns. But the other side of it is, I'm wondering what your comment would be, what the legislators were thinking when the scenario would be a man walks into or anybody walks into a grocery store with an open carry, and there's a child there that just is fearful of guns and has enough stress on them. What were legislators thinking about the child there, if at all? That's part of it.
Yeah, I mean, I think that in answer to the second question, I don't think they were at all. You know, very little gun legislation takes into account children's fears at all anymore. And, you know, we know that because teenagers and kids are voicing concern over it, you know, and the people who are creating these laws did not grow up in the schools where these kids are in that sort of state of fear all the time, because that is, anybody who has kids here knows that their child has thought about it at some point. They have, because they're asked to. You know, kids at a point, you know, that you can pretend that when kids are really young, a lot of these school districts say, oh, an animal is loose in the school, so we're going to hide in this closet because an animal might come into school. Well, when they get to 6 or 7 years old, they know that's not true. They know that they're hiding, that they're preparing to hide from a person with a gun who's coming to their school to kill them. And now there's a whole generation of kids who've grown up with that. The Columbine generation, the lockdown generation. I will say, in part because I've immersed myself in this universe. When I see open carry, it makes me nervous. Like, I have a bit of a physical and a visceral reaction when I see someone like a couple of weeks ago, I was in Chipotle and a guy walked in with a pistol on his hip. And just knowing, because I've immersed in this, I've covered so many mass shootings, knowing that if this guy wanted to, he could just kill me. Like, I'm 4 feet away, he could just kill me. It made me nervous, right? And I'm an adult who's been around guns in some way pretty much all my life. I mean, my dad hunted, I've just been around them, and it made me nervous. So now I'm imagining, well, what does a 7 or 8 year old in that Chipotle think when he or she looks over and sees this, right? And the truth is that they're not thinking, these legislators are not thinking about children and the effect that somebody walking around with a gun in their Publix could have, or their grocery store. They're not taking that person's emotional state, that child's emotional state into account. And I think too, there is this mentality among legislators that, well, the more laws they pass that expand gun rights, it makes it less likely that there'll be laws that go the other direction, right? So some of this is just they're just trying to create obstacles for the laws sort of that maybe restrict people's gun rights, because this creates something new for people on the other side to fight against, right? And so that's some of the thinking is, if we have open carry, then that'll take 2 or 3 years for the other side to fight against that. But this idea that like good guys with guns are going to somehow protect us all is it's just not based in reality. There are certainly anecdotal cases where someone opened fires and someone else shoots the bad guy. There are so many more examples of people walking around with a gun and shooting themselves in the leg, accidentally shooting somebody else, shooting the wrong person, the police showing up and shooting the good guy with the gun. It's probably 100 to 1. I mean, even when we looked at, I've reviewed every single school shooting since Columbine, and I don't know, maybe 2 or 3 times has the SRO, the security officer, actually shot an active shooter. It is incredibly rare. Many more times our school shooters are stopped because they're gun jams. That is a much more effective way of stopping a school shooter than a police officer shooting that person. It just doesn't work that way, because most of these shootings are over in a matter of seconds. They're 10 seconds, it's over. And so this idea that you'd have some sort of quick draw police officer there to shoot the person, it's just not based in reality. And then you extend that to the civilian population going out there, being our police on the street and shooting people who they identify as bad guys. We're going to end up with far more people, innocent people, being shot than we are bad guys getting shot. And that's just reality.
Thanks.
It's a good question.
I want to read a
talking about-
comment. Oh, go ahead. Go ahead, Bernice. I was just going to read a comment.
sorry.
I can come back to it.
Okay, you're talking so much about the open carry thing. I was even more disturbed about the automatic rifles that were brought to a demonstration in Fulton County that my pastor was at. And I was like, everything that I've seen demonstration wise here in Chambersburg in our area has been peaceful, completely. And my pastor walked up to these people who were holding these weapons and said, "Why did you bring them here?" And they said they brought them to keep the peace. I'm like, what?
Yeah. Yeah.
I don't know what the response is to something like that, except that I would stay very far away from those people. And I'm 62 years old. Some people in my family do have guns. And so it's not, I've never held a gun in my hand and I never want to, but there's a fear element for adults as well as for kids, as you mentioned.
Well,
Yeah.
it's interesting. I was speaking to one of the physicians who was reading the book, and he said, you know, Claudia, it's interesting. We require a test and licensing for a driver's license.
Right.
If you want to drive an 18-wheel truck, you have to go through more training. Yet, we'll give you, you can get a gun, you can get a background check, you'll get your gun, but then you can get like one of these AK rifles, and you don't have to have any additional training. You can, you just pass the background check. And then I was thinking, well, what exactly would we need a gun like that for? Like, who needs a gun like that? Yet they're out there. And people I know who are, gun owners, I know some that even have them, but I didn't ask them why. So if anybody out there has one in the audience that wants to talk about that, please do so.
Yeah, I know certainly when I sort of have that discussion, you get a variety of responses why people want to own an AR-15, let's say. There are some who say that, well, this is my protection when the government, comes to get me, or when, sort of we're living in a state of chaos, that's sort of post-apocalyptic, I'm going to need this to protect myself. Some people just want it because it's fun, because they want to go to the shooting range and fire it. The truth is that most people who own AR-15s or own any gun, they can safely own it until the day they can't, right? It's like you kind of don't know what your state of mind will be 6 months from now, or a year from now, or 2 years from now, or 5 years from now. People go through depression. They go through divorces. They lose jobs. And, somebody who can safely own a weapon of war, which is what those are. If you talk to somebody who served in combat, the way that they use their automatic weapons, seldom do they actually make them full auto. They in combat, they treat them with a semi-automatic. They treat them like semi-automatics. That's the same. So it's effectively the same thing that an AR-15 that a civilian could own. And if you can get an extended magazine, suddenly you're carrying a weapon of war. You don't need one of those to kill a deer. You don't need one of those to kill somebody who's broken into your home. So the arguments the rational arguments that someone should, own an AR-15, especially with these extended magazines, which is so much of the discussion really should be focused on the magazines, is how many, because that determines how many people someone could kill, really. I mean, that's what it comes down to. And the most violent mass shootings often are perpetrated because someone had a clip that held 30 bullets. And why would someone need that ever? There really is not a good faith argument to say that someone should have a magazine that can hold 30 rounds. Because why else would you need that other than to kill lots of people quickly?
I have a question. I hear the term a lot, universal background check. Can you explain what exactly that means?
Yes, that's a great question. In certain settings, people do have their backgrounds checked. So that's typically in like a federal licensed gun dealer. They're going to check your background. Usually they should by law. If you go to a gun show, let's say in Virginia or in lots of other sort of conservative leaning states, often your background check is you don't have your background checked. Or if you buy a gun from your neighbor or from the guy down the street or somebody you saw on Craigslist, or there's a website called Arms List, I believe it's called, where people are constantly buying guns from other civilians, right? So it's not a licensed gun dealer. They're just buying guns from like another guy or a buddy of theirs. And the problem with that is that those guns are often then trafficked. So, the reason there's something called the Iron Pipeline. I don't know if you've heard of that, but on the East Coast, it's called the Iron Pipeline. And it's where states and cities with strict gun laws, New York, Washington, D.C., Chicago, dealers in those places will drive down to states like Georgia, where there are much looser gun laws. They will go to gun shows, buy as many guns as they can. they'll have things called straw purchasers. These are people who don't have any kind of felony on their background. They'll go to a bunch of different gun stores, buy up guns. So they'll go down to a place like Georgia, buy hundreds of guns, drive back up to Chicago or DC or New York, and sell those guns for 3 times what they paid for them. So what would happen if we had universal background checks? The argument is that would end that practice basically overnight, because you could not legally sell a gun under any circumstance to anyone without running a federal background check, which would reveal whether or not this person had a felony, whether or not they were, let's say, buying guns from lots of other dealers. This would reveal that. So it's a way for all the different ways that people can get around our system, our regulations. It would stop that effectively.
Thank you.
Sure.
John, I'm going to read a couple of comments. One's from Yemi, another health educator in the WellSpan hospital system. Just says, thank you. One of the sections I found most helpful and enlightening was how you address the bystander trauma. The cost of this trauma is a cost for all in our communities: healthcare, mental health care, productivity, emotional well-being, etc., regardless of their opinions about gun control. A must-read book for everyone in our community.
Thank you.
And then Allie has put in the chat that during this discussion, I realized that my husband's pistol safe, though locked and at the top of the closet, is the same 4-digit code as my and his phone, which my 7-year-old knows how to play games on. And we will be changing the code on the safe today. So thank you for the education on this topic.
And that's such a great example, right? It's like what I found, and these parents I wrote about in the 4th chapter, the vast majority of people are responsible. They want to do the right thing. They want to protect their child. They just also want to own a gun, which is absolutely their right. And even like the parents in the 4th chapter, they had the gun safe. It was locked, right? But it was like, it's just that little piece where sometimes you just don't think of it in those terms, right? You don't think about, well, Mike, and I think the problem you just raised, honestly, is one that is true for probably thousands of parents who have gun safes, because we all tend to use the same code because that's the one we can remember, right? So honestly, I'm glad you raised that, because it's something I'll sort of include in future discussions, because I'm sure that is very, very common. Is every kid by the time they're 3 knows their parents' code to their phone because they want to play the games, right? And we all use the same code. So that I'm really glad you raised that.
And just an example of Tyler, his parents really had no thought that he would ever do anything
right
bad like that.
Right. Right. Yeah. Ever. They never considered that as a possibility, which, that's one reason why I wanted to write about Tyler, because I thought it's easier for parents to dismiss the child who has been expelled, like the child who was the school shooter in South Carolina. I mean, he was a walking red flag. He tortured animals. He'd been expelled from school for bringing a machete. And it's easy for parents to say, well, I'm going to ignore that because my kid's nothing like that, right? Whereas Tyler is like a lot of people's kids. This was a loving kid. He was devout in his religious beliefs, loving to his parents. And, they were home when he did it, right? They were home. They were right up the hall when he did it. So I thought that his story would resonate with people in a deeper way than a kid who was maybe troubled. And that the excerpt of the book, which was his story, his chapter, was, it might have been the most read story I've ever written for the Post. And I think that was why, because parents could relate, they could see their own child in him.
I put in the chat that a young man who was actually over 20 in the remote parts of our family recently committed suicide by gun, and most of his siblings, his parents, none of them recognized that he was depressed. They did know he was pretty obsessed with guns. So he was not only owning guns, he was building guns, he was building them for his young nieces who are toddlers, okay? And then suddenly he shot himself. And afterwards, it came out that he was very depressed. And he left a note for his siblings that said that he was taking his own life so that he wouldn't take someone else's. That is this is a prime example of what you are trying to say as the author here, that people change suddenly, or seem to change suddenly anyway.
Right. Right. Yeah, we just don't know. You never know what's going on, right, with somebody. Yeah, that's a great example.
Well, we're at the top of the hour. Did somebody else have something they quickly wanted to say?
So it's me, Sherry Morgan. I was just going to say that our suicide statistics right here in Franklin County show this to be true. Our young people and our women, but I just want to talk about our young people, kill themselves with guns because they're young people and their brains aren't totally formed
Right.
yet, and they're impulsive.
Right.
They can go hunting with their families. They can know everything they need to know about guns. And you can do all the harm reduction you want to do, but you cannot fix the fact that they are 16 years old and they are impulsive. And if you have a teenager and you want to continue hunting and doing things in the future with your teenager, it might be a good idea that while they're in those teen years, you remove the guns from your home or make them so inaccessible that they can't get to them.
Yeah.
Because in Franklin County, our young people are killing themselves with guns. That's all. Thank you.
Thanks, Sherry. Well, as we're at the top of the hour, I think Kim is going to close us off. But John, I want to thank you for joining us. We're going to have another discussion tomorrow evening, same topic of the book. So if you have any friends that you think would be interested in joining, please let us know. We have physicians, nurses, educators in the community. I want to thank all of you for joining us today. And I think I've come out of this with, a lot of things that I know I can do to try to help. Number one, I'm telling all my friends who own guns about the importance of locking them up and hiding the key. Bill, my volunteer, had the keys to the safe in his pocket. And then also that, we should contact our legislators to really talk about the importance of universal background checks. I mean, it's just something simple as that can help create change. So John, blessings and thank you so much.
Thank you.
Kim, I'll let you finish up. Bring us home.
Thanks, Claudia. Thank you, John. For the clinicians on the call, I have back up on the screen again the information you need to apply for CME credit. If you need some help, we'll be happy to help you get that done. As Claudia said, we have another book discussion tomorrow evening. If you're on this book discussion, you are welcome to come back. We'd love to have you, and please be on the lookout for an email with an evaluation survey that, again, we use to collect data to create and improve and continue programming out of our community services department. Again, I'll reiterate, John, what Claudia and everybody else has said. Thank you for being with us. And I have to tell you, this book will stay with me for a really long time.
Well, thank you. This was a great discussion, and I look forward to continuing tomorrow. So.
Yeah,
Wonderful.
And if you haven't read the book, we encouraged everyone to join us. The library has the book. I know our library here at the medical at Chambersburg Hospital, we have several copies of the book. Or get your own and pass it on to someone else. It truly, I think it should be required reading for everyone who goes out and buys a book. So maybe I'll advocate for that too.
Please do.
Thanks, everyone.
Thank you.
Thank you all.